those who have been the beneficiaries of this. Well, as we approach August the 31st, the White House is observing International Overdose Awareness Day by hosting families who've lost loved ones to overdose, along with advocates from across the country. Now, this is a moment reflecting on the devastating impact that overdose crisis has had and the need for action. In the U.S., we continue to face staggering numbers with over 105,000 lives lost to drug overdose in 2023. But the crisis doesn't affect all communities equally, and Black Americans, despite using drugs at similar rates as white America, are 4 times more likely to be incarcerated, but also less likely to receive any type of treatment. Even more, overdose deaths rates among white Americans has started to decline. However, it has increased by 7.5% for Black America. Here to discuss what is taking place at the White House and also the administration's efforts in combating this problem is Dr. Rahul Gupta, Director of the White House Office of National Drug Control Policy. Dr. Gupta, thank you for joining me today.
Well, thank you for having me over, Ebony. Appreciate it.
Absolutely. Let's start with what's happening at the White House.
Well, President Biden declared this week as Overdose Awareness Week, a time to mourn those we have lost, acknowledge the devastating toll the overdose epidemic has taken across the country, but also reflect on the progress we've made and recommit ourselves to doing even more to provide and support and save lives. Part of that was today making sure that we invite families over. And we talk to families of lost loved ones and learn from them, because this epidemic is personal for far too many communities across the country. You've mentioned the Black and brown communities where it has really impacted this epidemic has. So we want to make sure we understand what's going on. We continue to listen. We hear you. We understand you. We grieve with you. And we're going to work every single day hard enough to ensure that our nation, our communities have the resources that they need to end this crisis.
Now, let's talk about that. The theme for this year's International Overdose Awareness Day is Together We Can. What role do community organizations and local leaders play in working with the administration to combat overdoses, and how can Black communities get more involved in these efforts?
Well, it's the most important role, because this is where the rubber meets the road, where you are dealing with communities. We hear, and today we heard from both families of lost loved ones, but also advocates that going on into Black and brown communities, knocking on the door, and sometimes simply asking, how are you doing? And other times helping give the antidote, naloxone, to families to say, hey, just keep it in case. And what they told us was they were surprised because they were so welcoming, and they heard the stories and the reason they're there. They were welcomed in, but also accepted to in these communities. So it's really important that community-based organizations and others working on the ground have the resources that they need. And this is exactly where, from day one, the Biden-Harris administration has been focused on providing more resources. And indeed, we've been able to provide 40% more resources already in terms of tens of billions of dollars to communities than the previous administration. And it's a critical aspect, because this is how we are going to, and we are continuing to make progress.
We see a lot of conversation around harm reduction strategies, just like you said before, naloxone distribution and safe consumption spaces. How is the administration ensuring that these life-saving tools are really accessible, and what could be done more, if anything?
Well, first of all, the Biden-Harris administration is the first administration in the history of the United States to have harm reduction in terms of naloxone, drug checking, and certain service programs, make available and fund it for communities. Give you an example of drug checking. For a lot of communities, including Black and brown communities, often people don't know what's in their drugs. And when you have a fentanyl test strip or a xylazine test strip, you can check if fentanyl is in your drug supply. And that sometimes becomes the life-saving effort, just to know what's in your drugs supply. So these is a type thing that we're not only supporting and funding, but we want more people to know about this, that whatever the drug supply, it is not only not safe anymore, but it's much more dangerous because of fentanyl. And we want you to know what's in your drug supply, and we're providing the funding to make that happen.
There's been a push for overdose increase in overdose prevention centers. Even in New York, there was a rally that was held in honor of this week, with the demand for more of these types of centers in communities. Can you tell us what's your stance on these centers? How is there any way that the administration can do anything to increase the amount of these? What's the point of the what's the viewpoint, I'm sorry, of this administration? And when we talk about part two of that, what are the drugs that you are seeing most abused?
So let me start with the first part, which is, look, we are seeing now the drug epidemic to have so much lethal and dangerous drugs like fentanyl. We're also seeing cocaine, we're also seeing meth, but now literally all of the drug supply is being mixed in or cut with fentanyl, and often people don't know about that. And this is why the importance of carrying the antidote, having antidote widely available, and making sure the barrier is not cost, it's not access, and it's not being able to administer it. Now, when we began as the first time to add harm reduction to the administration as a federal administration, we wanted to make sure that we're taking the, naloxone drug checking, as well as syringe service programs. And then we're looking at evaluating and looking at all of the other programs that are happening across the country to see where the evidence emerges, what are the promises, practices that are happening. Look, this administration's focus and goal has been that our North Star is to save lives first. And this is an important piece of that shift, because for far too long, the United States has taken an approach of incarceration first, and that has not worked. And that's why it's important to make sure that people who are suffering from the disease of addiction, disease of substance use disorder, are getting the help they need. While we can always go after the drug producers and traffickers, and we're going to do that, there's no doubt. But at the same time, people who need help need to be getting treatment and life-saving medications as opposed to being in custody.
The U.S. has the highest rate of drug overdoses that I've been able to find globally. And with just 5 months left, as we heard the president say at DNC, he's got work to do. Is there anything else that is being done that you can talk about to help bring those numbers down, especially in Black and Brown communities in particular? Because one thing we do know about this failed war on drugs is that it had devastating, disproportionate effects in Black communities. Is there anything else that we can see come from this administration?
Well, I will tell you that neither President Biden or Vice President Harris are giving up. We're going to double down and triple down on the efforts that have been working, put investments back into communities, allow communities to take evidence-based approach and save even more lives. That starts with making sure that not only thousands of lives are being saved because of the efforts of this administration over the last 3.5 years. But today, for instance, we had folks attending from all across the country, from Massachusetts to Montana, urban to suburban to tribal areas. And it's really important that we send the message, especially to those who are most vulnerable, including communities of color, that you have the resources, and make sure you get those resources to be able to support and remove the stigma. Because one of the things that we talked about today a lot is that stigma is often a big factor in people not being aware or not getting the help. So one of the things we're going to continue to focus and double down on is removing the stigma across our communities, making sure they have the resources that they need, and then have access to life-saving medications like naloxone.
Just as we conclude, as we approach International Overdose Awareness Day, what is the message that you want to send to those who have lost loved ones to overdose, and those who are fighting this epidemic, and those who are in the street trying to help families and help rebuild communities?
Let me start by saying, we see you, we hear you, we understand you, we understand the grief. And we're so proud every time that when you turn your pain into action, when, as I heard today about so many families, they're about, we don't want someone else to lose their child because we lost one already and we know how it feels. I was in tears when I was hearing some of the stories today. For those who are on the streets helping, you are saving lives. You're doing the work that is the most important work one can ever do. And for those who are in the throes of addiction, let me just say, let's make sure we approach people with compassion, with empathy. Because oftentimes as a doctor, I've heard from people, when they heal, they will tell you, when people were nice to me, I remember. When people were not nice to me, I remember. So people, remember, let's treat others like we want to be treated, and start with compassion.
Start with compassion. I love that. Dr. Gupta, Director of the White House Office of National Drug Control Policy, thank you so much for coming on the record with us at American Urban Radio Networks.
Thank you so much, Ebony. Appreciate you.